everybody. Good morning. Well, good morning, everybody, and thanks for being here today. For more than a year now, we've been calling on Republicans in the legislature to protect reproductive freedom in our state and repeal Wisconsin's archaic 1849-era criminal abortion ban. A ban that's been on the books since before the Civil War and before women ever had the right to vote. And at every opportunity to do the right thing, and even as we saw our state, our healthcare systems, doctors, and Wisconsin women and families thrown into chaos and uncertainty, they have refused. Instead, last week, Republicans introduced their own bill, a bill that would neither meaningfully support survivors of rape or incest, nor does it provide freedom and protections that Wisconsinites had for 50 years until June 24th of last year when the Supreme Court overturned Roe. It's been clear from the beginning that I won't sign a bill that leaves Wisconsin women with fewer rights and freedoms that they had before U.S. Supreme Court overturned Roe. Simply put, the Republicans' bill doesn't cut it. And I want to be clear today, it doesn't cut it because it falls short of what the people of the state want and the freedoms they deserved. It's growing increasingly tiring for people in this building to accept the premise that restoring Roe and access to safe legal abortion are radical ideas that only Democrats support because they don't. They're not, they're not. Republicans, independents, Democrats, Wisconsinites overwhelmingly support Roe and safe legal access to abortion. Folks, that's a statement supported by data. It's not up for debate. And it grows increasingly frustrating to hear people suggest there's room for compromise when it comes to restoring the constitutional rights and freedom of Wisconsinites that they've had for almost 50 years before those freedoms stripped from them in one fell swoop on one summer day. Folks, you already know what I'm going to say. The will of the people is the law of the land, so I won't say that, although I just did. So today I'm proud to join Democratic leaders, Senator Kelda Roys, Representative Lisa Subek, and Democrats in the legislature today as they announce yet another new effort in our continued fight to restore Roe and the rights of Wisconsinites that Wisconsinites had for 50 years by repealing Wisconsin's outdated, archaic 1849 criminal abortion ban once and for all. We're not flirting with fringe ideas here, folks. What this bill will do is simple. It will restore access to safe, legal abortion in Wisconsin to what it was on June 23rd, 2022, nothing more and nothing less. The people of Wisconsin know where I stand, and that's with them. And we're going to keep fighting like hell every day until Republicans heed the will of the people, until every Wisconsinite has the right to make their own health care decisions, and until we guarantee that our kids and grandkids won't grow up in a world where they have fewer rights than we did, period. Now, I'm going to turn things over to Representative Subek, who's been a critical champion on this issue forever, to share more about the legislation she's introducing today. Lisa?
Someday I am going to figure out how to do that not awkward. You're lucky I did it for you. Thank you all for being here. I'm State Representative Lisa Subek, and as the governor said, we are here today to introduce legislation to restore Roe in Wisconsin. For nearly 50 years, Roe v. Wade was the law of the land and guaranteed us the right to safe and legal abortion no matter where you live. The Dobbs decision last June changed all of that, and Wisconsin is feeling its impact. Abortion care ceased in Wisconsin in June of last year due to the lack of clarity surrounding our 1849 abortion ban. Patients have been forced to leave the state Even those patients facing serious health complications have had to travel out of state to receive the medical care that they need. Wisconsin has a criminal abortion ban still on our books. It is the oldest ban in the nation. It is 174 years old. It is from before the Civil War. It is from before any of us were born, obviously. And it is from before women even had the right to vote and before we had women serving in office. I want to be clear that abortion is health care. And as long as doctors face prison time for providing health care, and as long as extremist Republicans continue to put politics ahead of our health, ahead of our rights, and ahead of our freedom, abortion will remain unavailable in Wisconsin, and we are working to change that. As the governor discussed, there is a lawsuit pending, but we can't just sit and wait for the courts to act. We need clarity now. Just this weekend, I was at an event where I spoke to a woman about her daughter who was attending college out of state. She was not happy because her daughter had planned to return to Wisconsin when she finished her degree. Her daughter has begun interviewing for jobs out of state because she no longer wants to return to Wisconsin, to a place where she couldn't get the care she needs should she need it, and in a place where her future children may not be able to receive the care that they need. Every pregnancy and every situation is different. We believe in the rights of individuals to make our own reproductive health care decisions in consultation with our families, our physicians, those we choose to involve, but without interference from politicians. To be clear, it is your right to decide when and if you start a family, and whether or not you terminate a pregnancy. Or whether or not you terminate a pregnancy, whether that's an unplanned pregnancy or an untenable pregnancy, a planned pregnancy where something went terribly wrong. It should be your right to make those decisions. Wisconsinites have made their views clear, and they overwhelmingly support repealing our archaic 1849 criminal abortion ban. That is why we are here today, introducing the Restore Roe Act. Our legislation would restore Roe in Wisconsin by overturning Wisconsin's archaic abortion ban and returning the state of abortion access here in Wisconsin to exactly what it was last June when Roe was overturned. And with that, we will restore our freedom to make our own decisions about our bodies, our health, and our futures. With that, I'd like to introduce Lieutenant Governor Sarah Rodriguez.
Thank you for the box, Representative Subek, and good morning. So I am proud to be standing here with my Democratic colleagues and Governor Evers as we renew our calls to the Republican leadership to listen to the people of our state on an issue that is so deeply personal and has such profound consequences. As a public health professional, as a nurse, as a mother, I know that abortion is healthcare. And as a Peace Corps volunteer, I saw firsthand the impact the lack of access to reproductive health care has on a woman, a family, and a community. And what's more, as a state, we are already struggling to recruit and retain talented workers, particularly obstetricians and gynecologists. We know that we cannot expect more people to move here if they have to give up basic freedoms to be able to do so. Yet time and again, Republican leadership in this state has had the opportunity to do the right thing, to protect the health and safety of Wisconsinites and to defend reproductive freedom. But time and again, they have failed, especially when women, patients, and providers needed them most. Every single Wisconsinite should have the right to make their own reproductive health care decisions without the interference of politicians who know nothing about their faith, their family, or their circumstances. As elected officials, it is our job to listen, to respond, and to be held accountable to the people who elected us. They deserve to have leaders who listen to them. They deserve to have the rights they have had for over 50 years to make their own decisions about reproductive health care. That's what this bill is about today. It's about solutions, It's about listening to people who elected us to serve. And yes, it's about doing the right thing. And so with that, I would like to introduce Senator Royce.
Thank you, Lieutenant Governor. I'm not sure I need the box, but I like having it. And it seems easier than trying to figure out how to put it back in. I'm delighted to be here today. Women and not politicians are the ones who should make decisions about our own bodies and our lives and our health. That is self-evident. Abortion is basic health care that about 1 in 4 Americans will need in her lifetime. And Wisconsinites overwhelmingly want us to restore Roe v. Wade and the rights we had. This is not controversial, despite the very best efforts of anti-choice extremists to make it appear so. About 2/3 of Wisconsinites are pro-choice. And according to a Spectrum News and Siena College poll last fall, only about 5% of Wisconsinites support or agree with the draconian 1849 language we're discussing today. That's the very statute we propose removing with our bill. Now, if our state was not so severely gerrymandered, that 1849 ban language would have already been repealed because there would be political accountability between elected leaders and voters. We've seen all across the country, in red states, in purple states, in blue states, voters again and again demonstrating their support for abortion rights, for Roe v. Wade, and we're going to continue to see that until our rights are restored. We cannot afford to make Wisconsin an even more hostile place for healthcare providers and for pregnant people if we want our state to thrive. We already are facing a grave shortage of workers, and specifically healthcare workers, especially in the most rural areas of the state that tend to be represented by the most anti-choice politicians. One of the most serious shortages we face is in OB/GYN care. This is very personal to me as a mother. We are competing with other states that trust physicians and let them take care of their patients without political interference. Now, when Wisconsin can't even get our act together to get this old language that almost no one supports off the books, and then our politicians grandstand by threatening physicians, we're going to lose more and more doctors, more OBs, family practice docs, and other healthcare providers. And we're already losing out on the very best and brightest med students who don't want to come to a state where they're not going to be able to get the medical training that they need to save their patients' lives. Every single one of us loves someone who will need an abortion someday, and no one should be treated like a criminal when they do. When abortion is available, people suffer grievous harm. Women die. When abortion's criminalized, it's the people who are already the most marginalized that suffer the most. Young women, poor women, victims of abuse, women of color who here in Wisconsin suffer some of the most grievous racial disparities in healthcare. Now, criminalizing abortion has never stopped abortion. It doesn't reduce the need for abortion. And that's even more true today because medication abortion is safe and accessible via websites like aidaccess.org. But not enough people know about these options, and they are not an option for all pregnant people who need abortion care. And although right now there are no criminal penalties for self-managing abortion in Wisconsin, that is one of the leading priorities of some of the most powerful GOP lobbyists in our state and nationwide. Indeed, just last week, Republican legislators introduced legislation to make what I just said illegal, to gag state employees or people in a public building from speaking and providing accurate information about abortion. There's a clear contrast here. Democrats are united in our determination to restore Roe and protect people's fundamental rights. We want to ensure that everyone who needs abortion care is treated with basic dignity and respect and is able to get the care they need from a healthcare provider. Republican politicians and lobbyists, on the other hand, they're fighting amongst themselves as they work to further trample on our freedoms by making the 1849 law even more extreme, by attacking birth control and fertility treatment, and then criminalizing free speech. Today and every day, Democrats and Governor Evers are going to stand with Wisconsinites who value our rights and freedoms and will restore Roe v. Wade. Thank you. And now I'm delighted to honor and introduce Dr. Kathy King, an obstetrician gynecologist.
Thank you. Hi, good morning. My name is Dr. Kathy King, and I am an OB/GYN physician who has practiced medicine for over 25 years right here in Wisconsin, since my graduation from the esteemed UW School of Medicine in 1997. I have been honored to care for tens of thousands of pregnant people over these many years. I know, as do my medical colleagues, that pregnancy can be many things. I know that pregnancy can be joyous and amazing, culminating in the birth of a beautiful, healthy baby. I know that pregnancy can be devastating when complications occur. Severe fetal birth defects are diagnosed, membranes rupture before viability, severe maternal health conditions coexist. And I know that life is not perfect. Birth control fails, people live in poverty, our social safety net is inadequate, domestic abuse happens, debilitating mental illness and drug addiction happens. Decisions surrounding pregnancy are nuanced and deeply personal and should be free of political or ideological interference. In medicine, we prioritize patient-centered care, care that is respectful and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decision-making. As an OBGYN, I and my colleagues honor and respect each individual's right to make the deeply personal decision whether to continue or terminate a pregnancy based on their values and unique life circumstances. Individuals have a right to adhere to their deeply held personal beliefs when it comes to their own life decisions. If we believe that we are a nation based on individual liberty and freedom, what can be more paramount than be free to make our own personal healthcare decisions? Since June 24th, when the Dobbs decision overturning Roe abruptly halted abortion in Wisconsin, as has been said, people are now forced to travel out of state for abortion care or forced to continue a pregnancy against their will. I have continued to care for persons who have decided to terminate their pregnancies. However, the care I provide is now happening outside of our state, in the state of Illinois. I see people traveling from Wisconsin and some of the other 14 states, such as Missouri, Kentucky, Texas, Mississippi, that have criminalized abortion with almost no exceptions. These people are real. I have cared for a 17-year-old traumatized and pregnant from rape who had to flee Wisconsin. I just cared for a 44-year-old diagnosed with leukemia who became pregnant when her birth control failed and she had to flee Wisconsin. And I cared for a 28-year-old currently caring for her 2-year-old child dying from a rare neurodegenerative disorder, and then learned that the fetus she is now carrying had the same devastating syndrome. She could not bear to watch another child slowly die. The fact is that 6 in 10 people having abortions already have children. They are making these complex decisions for the health and well-being of themselves, their family, and their future. I and my colleagues who provide abortion care sit and we listen to our patients. We hold their hand, we counsel them, and at times we are crying with them, honoring and respecting them. My lived experience has taught me many things, even that people who identify as pro-life may at some point decide to have an abortion or support someone having an abortion in the context of overwhelmingly difficult circumstances. We all know someone who has had an abortion, a family member, a friend, a coworker, whether we know it or not. As people are denied health care in banned states and forced to travel to haven states to access care, we have seen an uptick in abortions now occurring later in pregnancy, the very thing some abortion bans claim to be trying to prevent. Patients whose pregnancies are complicated by ruptured membranes before viability are now frequently being denied care at hospitals, left on their own to find care out of state, some arriving bleeding, infected, due to the delay in care. We know that some people who can't afford to travel are now turning to self-managed abortions with medication obtained over the internet and through the mail. Patients are being left to fend for themselves because healthcare providers fear criminal prosecution. None of us went into medicine to be criminalized. So the fear is real. Fear based on fear of criminal prosecution has affected care and has replaced patient-centered care. Since Dobbs, we are seeing ever more extreme attempts to limit abortion access, even in states where it is legal. The recent target has been medication abortion, which we know now is used by the majority of people terminating their pregnancies. A case before one federal judge in Amarillo, Texas, could stop access to mifepristone, one of the drugs used in medication abortion, in all 50 states under the baseless claim that it is unsafe. Mifepristone was approved by the FDA 23 years ago and has been safely used by over 5 million people, along with misoprostol, for medication abortion as well as miscarriage management. Creating more barriers to safe abortion care is happening at a time when we are seeing the maternal mortality rate continue to increase in our country, especially for women of color. In 2021 report, the maternal mortality rate in this country increased by 40%. That should give everyone pause. History has taught us that extremist laws that drastically curtail or eliminate access to safe abortion result in devastating consequences. We should learn from our history, not repeat it. In the not so recent past, abortion restrictions were often framed in the guise of trying to protect the health of the mother, supposedly because politicians, with due respect, with no medical training, although some do, know better than highly trained healthcare providers practicing evidence-based medicine on how to provide safe care. The pretense of caring about women's health is quickly fading with the shift to ever more draconian laws and policies. The head of Pro-Life Wisconsin, who lobbies some of our legislature, has been recently quoted stating that the current exception for the life of the mother under Wisconsin's 1849 criminal abortion ban is too broad. An exception for the life of the mother is too broad. That is extreme. These ongoing political and judicial interferences into the practice of medicine and people's personal lives should give everyone pause. Wisconsin's 1849 criminal abortion ban is a dangerous, shameful relic of our past, and polls show a majority of Wisconsinites feel the same. So with great gratitude to Governor Evers, Lieutenant Governor Rodriguez, Representative Subek, and Roy for introducing the Restore Roe bill to repeal Wisconsin's extreme, unjust, and dangerous criminal abortion ban.
Thank you, Dr. King. And so here we go. We have a bill. Let's have a debate. Let's have a debate. The Republicans have their bill. The Democrats have their bill. People of Wisconsin should be able to hear a debate about this issue, not silence. We need a debate. So with that, we'll be glad to answer any questions people have.
Find that election through an appointment instead of a special election?
Sure. I heard about it last Tuesday, or whenever the letter was written, and I talked to Sarah Rodriguez for the first, or Sarah Godlewski for the first time on this issue last Wednesday, and I appointed her because her previous position in the state intersected significantly with Doug LaFollette's position, role in the state, especially around the Board of Commissioners of Public Lands, which is a really important part of that job. And so she will be a perfect fit for that. And that's why I appointed her. I did appoint, and no one complained about this, oddly enough, when I left the office of state superintendent, I had an appointment of Carolyn Stanford Taylor. Silence. Next question.
Do you think that it's fair to appoint not call special election for SOS to just hand Godlewski a job, which some would say is just another 4 years of campaign for her next, it's a stepping stone for her, and you just handed it to her?
Why did I not hear one word when I appointed Carolyn Stanford Taylor as state superintendent of public instruction, which I would argue is even a more high-profile job than Secretary of State? She'll do a great job. She's been part of the executive branch of government, and I trust her implicitly.
Taylor, with all due respect, Taylor is not coming off the Senate run, and she did not step down to clear the way for another candidate.
Who cleared the way for another candidate? She decided, as I understand it, she decided not to continue her race because she felt she was not going to win. I mean, this is such an odd story that the Republicans have put in place here. The idea that somehow I colluded with Godlewski and Mandela and all these other people. I think I talked to Doug LaFollette last week, or I received his letter. I think I saw him at the inauguration, and I said, "Good speech, Doug." So, good speech, Doug. 3 words I've had with him over the last several years. There was no collusion. He gave me a letter. He brought my office a letter saying, "I'm sick of this stuff." He left. I appointed a completely competent person to do the work, and that's the end of that story.
Last question. Governor, you just introduced this today, this bill. Does the timing have anything to do with the Supreme Court debate today?
No.
And also, earlier, the Republicans, they couldn't even get the rape and incest off the ground. They were infighting about that.
Right.
How do you think this is going to go?
Well, I'll let any one of these women behind me talk about this, but my goal is the people of Wisconsin have talked about this time after time after time through polls and otherwise. You heard a doctor talk about the extraordinary impact of this 1849 law on women's lives in the state of Wisconsin. We know what the polling says. The minimum that we should have is an open debate on it. Let's have an open debate, and I'm glad to let anyone else jump in. Okay,
We agree.
great, thanks.
News 3 Now is always on.
Get the Channel 3000 app, activate the push alerts, and we will send you breaking news, traffic, and weather alerts as it happens.
The Channel 3000 app. Get it now.
Powered by News 3 Now.